I'm the clinical support representative for Steris. I'm going to be in-servicing the Cmax X-ray table today. I'm going to start from the bottom and make my way to the top. I know this is kind of like a refresher and you guys have had this for a while, so I'm going to try to hit on the main points. There's a lot here, so try to stay focused and save your questions, write them down or whatever for the end, and I'll try to answer them. But anyway, let's go ahead and get into it. So we'll start at the base, like I said. If we look on this back side right here, these are the basics. Obviously, we're going to talk power right now. This looks to be like the other surgical table general plug-in right here. But right above it is a grounding station if you guys were to need that for some reason. And then there's also a battery signal that shows you kind of on an LED lighting system where you guys are in your battery life. This surgical table specifically takes like two pretty much car batteries, and they go in this little trunk right here in the T. So the battery is typically going to last about 1 or 2 weeks, depending on what kind of surgeries and how much articulation turned over until whatever you guys are using is being implemented into your surgeries, right? So as we move up, you can see that their weight limits are listed on the end of the surgical table right here. The weight limits for the surgical table, there's a couple of them, right? If the patient's in normal orientation, right, doesn't matter where we are, if we're floated to the foot or to the, we're right here in our quote unquote origin position, which is a word you guys are going to need to know here in a little bit, origin. The weight limit's going to be 507 pounds in normal orientation, even with float. Don't worry, I got a hard minute. As I was telling Ethan, I don't know what kind of accessories you guys have, and I'll dive into that later. But it plays a role in the patient weight capacities. If you guys have one of our Steris headpieces that is going to go on this normal orientation side of the bed, you're going to increase your weight limit from 507 pounds to 590 pounds. Now, if we were to flip the table with reverse orientation, I'll show you guys how to do all this stuff in a little bit. And we added a headrest to this foot end, which would now be the head end because we're putting the patient head here to flip the table into reverse orientation. Your weight limit is going to be 297 pounds, and I think that's right. Both those, like before I said right there, but the one I just mentioned, reverse orientation of the headrest that can go on the foot end is 297. So just kind of keep those in the back of your head, and I'll send any like specific information his way. All right, now we work into like the main center of this surgical table. So as you guys can tell, there's 2 surgical table remotes here. One's like a surgeon joystick that's going to drive what we call float / our slide on this vascular table. And I'll show you guys kind of how that works here in a second. But if you guys want to come in closer so I can show you guys and you guys can see this surgical table remote, I know it's hard because we have a lot of you guys, but it's important that you guys kind of get a little closer. If you guys aren't familiar with this table, so I can show you guys how to lock the table in. Right now, the table is unlocked. Anytime before, when I roll this table into the OR, I'm going to lock it, obviously, especially before the patient gets on there, but just so I don't forget. This is a 2-step process of locking the table unlike your other table. So there's going to be a button at the bottom right here. It's got like a little unlock and lock button, right? Right here. If you press this, you're going to see a menu that pops up. Or not a menu, but like 2 little, there's going to be rollerblades, and then there's going to be these lines in the ground with the table base, essentially. I don't know if you guys can see that right there. You want to try and get that? See the locking right there? So if we click the one if we press this button right here with the white line under it to the one with the lines, that's going to lock our table, right? So if I hold this right here, you're going to see a little hourglass in the middle at some point. But anyway, exactly what I said, and that's how you lock the table. If you want to unlock it, vice versa, it's just a 2-step process, right? So you're going to click the bottom right, then you're going to see that menu pop up, and then you're going to click whether you want to unlock or lock, right?
Is there a reason for the 2-step process? Because a lot of people get so confused. Is there a way to bypass that, or?
No, there's no way to bypass that, and I'll dive into that later too.
Okay.
I think it's probably a safety thing, so like.
It
you
is a
can
safety
accidentally-
thing.
yeah.
And then there's also a reason, and it'll play into our, so a lot of our general surgical tables are general surgical tables, and like I said, we can just kind of write down the questions, that way I can get through everything. Still, there's a lot to cover. There's a two-step verification process with their backup. It's not a hand control, but a backup control, if you guys were to lose power, is literally right here. And as you can tell, there's buttons on it. I'll dive into it later. Those buttons, if I were to accidentally hit one with my knee or I was a surgeon, we don't want that. We don't want that move to be made because it was accidental. So I'll explain that a little bit. But there's also a two-step process to that, so it kind of plays hand in hand. Anyway, if we move on from the locking, you're going to see that you have a couple of different options on the surgical table remote. You're going to have Trendelenburg, which you're going to have 30 degrees Trendelenburg. You're going to have 20 degrees of tilt, which I'll demonstrate. Your tabletop is going to go, it's fine. Your tabletop is going to go 41 inches at a maximum height, which is a pretty adequate table height for vascular cases. I don't think anyone really needs to be up here working. More so, it goes to also an adequate height at 26 inches is the table low height, which is the standard for a lot of our like older, middle class general surgical tables that have been doing great work for a long time. So it's a good height, and I'll show you guys that here in a sec. This is that 30 degrees true power. And then I'm sure you guys are familiar with the leveling button as well on the surgical table remote. If I just press this button right here at the bottom left that I'm pressing, a little circle with like 2 arrows, it's just a level button. It's going to take whatever articulation you have out of the table and put it back to its to where it needs to be, right? So we've covered the Trendelenburg, table height, maximum low height, which I'll show you guys here in a sec. Just going to accommodate shorter surgeons, bigger patients that are having trouble with, their seat in. You guys are trying to move over the table. There's different ways to accommodate. So this is going to be our low height at 26 inches. So, we get to a pretty good high height for what we need to do, and then honestly, a really good low height. So, any shorter statured surgeons will be much more comfortable getting in here and being able to operate, especially with the ergonomic design that this T has right here, where the patient can kind of stick their feet in on the left or the right side. Okay, so let's raise this puppy up, and there's a couple more settings on the surgical table remote. I've gone over everything: trend, tilt, level, unlock, power the table on or turn this general surgical table remote on. All you gotta do is press like one button, any button besides the stop button, pretty much. And that's pretty much it for this general surgical table remote for now. There's a couple advanced settings. I don't know if you guys have ever seen. There's a drive mode, and then there's a rotational 360 rotational capability that this table can do, and I'll show you guys how to do that here or at the very end. Don't want to forget about that. Sorry, I should have asked you guys. Okay, awesome. All right, so. All right, we're going to keep an eye on this guy for a little bit. Just leave him there. Now we're going to move over to this surgeon joystick hand control right here. Now this is this is what makes the Cmax X-ray table the Cmax X-ray table, is the ability to flow. So currently I press any button on the surgical table remote and I gain the ability to turn it on and then be able to use it. Same thing's going to apply here. If I hit any button on this joystick control right here, the control will be taken from the surgical table remote to the joystick. So if I just click this orange button like this, you'll hear a beep like that, right? Now what we're going to do is I'm going to show you guys. I'm going to take this over first. I'll show you guys. So you're gonna have 4 buttons on here. There's an orange shrouded button, which is essentially gonna tell this table that we're ready to go in float mode right here. That's shrouded in orange, and I'll go over that here in a second. But this is gonna be important whenever we wanna float. All right. So on this remote too, we're also gonna have a height up and down surgeon control button right here if we wanted to bring the table up or down. And then we also have a level button, which is important because, and I'll show you guys here in a little bit. So I press this down, I have action and power, and this is the control that's making all the movements now. I'm going to press that button that's shrouded in orange right here, and it's gonna give me a green light, right? A solid green light. You're gonna see a couple of different lights at some point during utilizing this tabling, because I know someone's gonna forget something, and it's gonna show you either a white, a blue light, or a green light, right? And I'll go over those at the end too on what those mean. But for right now, we're green, right? So we're good to go. We've got control, we've turned the green light on. This green light's important because you're gonna drape over this. The surgeon's going to see this green light coming through the drape. And they're gonna use this by pressing down, and they're just gonna flow, right? And that's how you flow. You're gonna get 27 inches of slide with the surgical table, straight down, and then you're gonna get 5 each side, patient left to right laterally, right? So, once we stop, we kind of operate here. If I wanted to, if I was a surgeon, I got the table down here, or I didn't want to start down here to get that down here. And I wanted to operate from down here. Here's that blue light. Did you guys see that blue light? So when it disconnects, the blue light right there that you guys just saw when I disconnected that, and I'll show you, there's a little pocket for this as well. It doesn't charge it or anything, just leaves it there. You see that blue light, it means that it's trying to connect Bluetooth because this is a wireless configuration. So what you'd be able to do normally with these accessories, we offer side rail accessories, and I don't know if you guys have them, but it's nice if the surgeon wants to move around the surgical table. They can essentially slide one of these side rails on right here, clamp this down here, clamp it right here, clamp it right here, clamp it over here, and they can move from any side wirelessly. That's that Bluetooth trying to connect right there, so that's that light. It's important that you see these lights because the only time that your float's going to be able to work is when the light is fully green, right? So, go ahead and attach this. It's kind of a pain to get back on. See the white light? So what this white light means is pretty much saying that the table is not level. So okay. So all right, so I showed you that we can kind of move around this remote. I showed you kind of what the meanings of those lights are. This green light though is essentially saying that we're good. We're in the origin position. We're going to go to flow. If we weren't in this origin position, and I'll tell you guys how to get to this origin position. Essentially, the origin position is this surgical table, carbon fiber board pushed all the way to the patient normal orientation, normal patient head, all the way to the head. So. Like, let's just say, just make sure that you're gonna wanna push it all the way, and you'll know, like if you come feel it, like we're all the way back towards the patient head. And to get to the origin position with this float, you'll have a grid right here, right? So I'm moving this, right? You see those coordinates kind of move, right? So when we get to 0, 0, that's when we know we're in the origin position, which there's an X and a little box on that tabletop. Just play it like, it's like a little game. You want to put that X in the box, and that's when you know you're in that origin position, right? So, and you're also looking for 0, 0. So there's a couple of different ways you can do that. So once you do that, once you're in this position, you can now unlock or lock the table. This position's important because without being in the origin position, you can't unlock or lock the table. There's a lot of things you can't do. So it's important to remember where we started, where we're going to, and then how to get back to that origin position. So that way we can safely unlock the table and get the patient off, right? Let's see here. So if I were to tilt this table or make another articulation with Trendelenburg prior to me floating the table and sliding the table down, the table actually won't allow me to do that, right? So I'm gonna see if I can make it air for you guys really quick and kind of show you what I'm talking about. So if let's see here. So if I put a little bit of Trendelenburg on the table, just a little bit, right? And now, let's say, I'm hoping this works, I don't want to be an idiot. But let's say I want to float the table now that I have a little bit of Trendelenburg. What do you guys notice about this deal? We have a white light popping up, right? What that's telling me is that I need to level the table, put it to its origin position before we can float. Once we float, then we can articulate, right, with Trendelenburg or with tilt. Sorry. So, all we gotta do, if I was a surgeon, it's over here or whatever, we're gonna hit the level button, sorry, right here. It's gonna be all draped up, it's right next to that button that creates action. And look, we're solid green. So we're level right, we're in the origin position. Now we can kind of move this to where we want. Okay. Come back, use this as our guide. X's, 0, 0. It's pretty easy. And you just kind of, it's not as bad as you think it is once you start to get your hands on it and start to see it a little bit. So let me think here. That's pretty much all for the joystick side of things. This table is just a flat piece of carbon fiber essentially, so it doesn't break or bend or anything like that. It's just those couple articulations. And then if we move down to the backup control piece right here, this is like I said earlier, this is like a two-step verification process to ensure that the action being pressed on here is the correct one. So like if I'm the surgeon, like my knee comes down here, like I said earlier, I hit like table up or something like that, it's not gonna do anything. See how I'm pressing it? So what we have to do is we have to verify our action. So we're gonna press this orange button, this orange V right here, and in the case that we need to get a patient to a safe level position, we can, this control right here has the flotation device ability in it, and it has, you know, leveling the table, Trendelenburg, whatever you need to do, height up and down. So let's say I needed to get the, I don't know, let's try Trendelenburg. What I'm gonna do right here is I'm gonna press this V and I'm gonna press this Trendelenburg button going down, and you'll see that it's gonna start beeping and doing that action as you request. That beeping is just gonna tell you, hey, someone's, you know, authorizing the backup control. So that's just the safety feature that it has. That white and the white light that I showed you guys earlier that wouldn't allow you to articulate Trendelenburg or tilt prior to floating the surgical table. Yeah, okay. Golly, sorry, it's so early in the morning, I've gone everywhere. I don't know where I was going with that, I need something. Anyway, that's kind of all, that's pretty much it. Sorry guys. 360.
Good job.
360, thank you, see. Floating your teeth going off a little bit, okay.
And just remember everyone, we have another in-service after this, so don't go anywhere. Pretty quick.
Yeah, sorry, I know this one's pretty long. There's just a lot of cover. Okay. But you guys, is everyone comfortable with the backup control and everyone feel decent about the joystick? It is a surgeon joystick, so most of the time the surgeon is going to be operating this, but it's important that you guys know because, I mean, they're going to be coming to you guys with questions, right? So, but yeah, does everyone feel comfortable right now with that so far? Okay, cool. So let me move on to the two advanced settings that you guys have. So there's a drive mode. If you guys wanted to move the surgical table in and out of the operating room, it's just like a little, it's just less weight bearing, I guess, on you essentially. And then there's a 360 mode. So to get to those modes, there's a menu button right here, or a memory button, sorry. You'll press this memory button right here where it says mem. And then you'll see at the top, it says memory 2 right here. And then there's a memory 1 that will pop up when I navigate through the menu like this. Full slow. There we go. I just have to press. So memory 1 is going to be the rotational 360 ability, right? So if we wanted to, so we're going to press mem, and then we see mem 1 pops up. We can navigate the menu right here. There's a 360-degree button that's underneath this white little layer right here. So if I were to press, we're on that memory 1. If I were to press that button right here, what it's going to allow me to do, it should unlock the surgical table, drop a fifth wheel, I believe, in the dead center, and then allow me to rotate but not move. Well, I'll have our service guy come check that out.
Okay.
But that should be a feature. Essentially, it's going to drop the fifth wheel, really easy to use in the center. It's going to unlock the 4 different pedestals that it currently has, and just allow you to rotate 360 degrees in that same spot without going anywhere, right? Drive mode, it's going to be a similar deal. You're going to press the button and just kind of hold on the table, use this to drive. Let me show you that.
Maybe I'll pop on the float mode.
No, we're good.
Is
Might
there
just
an
be a
origin
service thing.
position?
Yeah, I'm gonna have our service tech look at the advanced settings on that, but for the most part, I mean, you guys probably won't be using those currently.